Welcome back, Careblazer. In today's video, I want to talk about some conditions that can look exactly like dementia, but they're not dementia. I like to call these dementia lookalikes. And the problem here is that if you just assume that these symptoms that you're observing are dementia, then it can lead to you and your loved one living a significantly lower quality of life. Sometimes when older adults start to forget things or start to show some episodes of confusion, it's really easy for people to just assume they must be showing the beginning stages of dementia. However, it's entirely possible that it can be something completely different. So I want to go over some of the most common culprits that look like dementia but are not dementia. Depression. Older adults who are depressed oftentimes can look like they have dementia. They may not have very good concentration. They may be forgetting a lot of things. They may not be keeping up with their basic hygiene. They may have very little energy, not want to get out of bed, not really engage in any activities. And it's really easy for this to get confused with dementia. However, with depression, there are some treatments that can be helpful. So it's important that your loved one is getting checked out and making sure that they are not depressed. Also, it's entirely possible for somebody to have dementia and then have depression on top of it, which makes the dementia much, much worse. So we always want to try to find out if your loved one is depressed so that there can be treatments to try to help alleviate that depression. Hearing loss. Hearing loss happens as people age, and it's very easy for people to just assume somebody's memory has worsened. If information that's being said isn't heard, then there's no way that you can remember it, right? It never got in the brain in the first place, but it just looks like the person forgot the information. Unfortunately, this is a very easy thing, right, to discover and get fixed, but it doesn't always come to the person's mind. Like, it's not frequent where somebody would say, maybe my hearing is going. Maybe I should get my hearing checked. Sometimes it requires a family member or a loved one to say, let's make sure we get your ears checked. Let's make sure the hearing's okay. A lot of times the person who's having hearing loss doesn't sometimes think that they are having hearing loss. It may not cross their mind. So it's very important as people age to make sure their hearing is getting checked. Delirium. This is another common condition that can happen, especially in old age, where basically there is an underlying condition, like an infection. For instance, a urinary tract infection, where it causes the older adult to look completely impaired, completely confused. They can look like they have dementia, when in fact there's an infection going on underneath that just needs to be treated. Also, this is something that can occur in somebody who has dementia, and when it does occur, the dementia gets a lot worse, and it's really easy to assume that it's just the progression of dementia, when in fact it's a sign of an infection that needs to be treated. Low vitamin B12. Low vitamin B12 can lead to symptoms that look exactly like dementia. That's why it's important to make sure your loved one is following up with a primary care doctor, that regular labs are being drawn, and anything that can be treated or improved, by all means, work on getting those things treated and improved, because people with low vitamin B12 who start to take supplements and their B12 levels rise, their thinking starts to improve. Normal pressure hydrocephalus, otherwise known as NPH. This is where cerebral spinal fluid starts to build up in the ventricles of the brain because it's not absorbing or draining like it should be, and the ventricles are starting to expand and press on other areas of the brain. This leads to confusion, balance issues, falling, and incontinence, urinary incontinence. And this is something that can be relieved with a procedure such as a shunt placement. And many people who go through this experience improvements in their behaviors. It can help pretty much reverse a lot of those symptoms. So it's always something to get checked out. All that being said, Careblazer, basically, if your loved one is showing new symptoms of cognitive impairment. Maybe your loved one has mild cognitive impairment and is starting to show increased difficulty. Maybe your loved one already has dementia, but for some reason seemed to have taken a really big turn for the worse suddenly, really quickly. It's just always important to make sure you're following up with your loved one's healthcare provider, their primary care provider, let them know what's going on. All of these conditions can present without dementia and can look like dementia, and all of these conditions can present on top of dementia, make dementia look worse. We want to make sure that none of these are being missed. If there's anything at all that can be improved in your loved one's functioning and their brain functioning, by all means, let's figure out what we can do to improve it and improve quality of life for your loved one and for you. Careblazer, thank you so much for watching this video. If you haven't already subscribed to the channel, go ahead and do so. All you do is hit that red subscribe button on your screen. It's completely free, and it just makes sure you don't miss out on any updates. All right, I'll be back next week with a new video. Bye.